Hi, my name is Christina, and this is my IV fluid and medication administration video. Today, my patient will be receiving IV fluid and IV medication, amoxicillin. So here is my math to figure out the drop factor for the fluid and the medication. The fluid, 150 mLs over 60 minutes times 15 drops over 1 ml. We get 38 drops per minute. On the medication, we have 15 drops over 1 ml times 100 mLs times 15 minutes, and that gives us 100 drops per minute on medication for amoxicillin. First thing I would do is verify the physician's orders. Then I would perform the 6 rites of medication administration: right patient, right dose, right time, right medication, right route, and right documentation. I also want to identify the patient with 2 separate patient identifications. I'd also want to ask the patient if they have any allergies, and also verify that with their chart. I would provide patient privacy, of course, perform hand hygiene, and go ahead and put on some gloves to start. Next, I am going to go over the different parts of the primary and secondary tubing. So here we have our primary tubing, shows 15 drops per ml. Secondary tubing is the same, showing 15 drops per ml. For our primary tubing, we have our spike here. So this is a cap on it. We want to keep this cap on to keep it sterile until we are ready to use it. Next, we have our drip chamber, this we want to fill up halfway, and this is where we will also reassess our drop factor to make sure we have the correct counts. Next, we have our roller clamp here. This is where we can change the drip factor, faster, slower. We always want to keep this in the closed position until we're ready to administer the fluid or medication. Next, we have our Y port. This is where we would insert any push medication. This is also where I'm going to add my secondary tubing with the patient's amoxicillin, the medication. And finally, the last piece here is the adapter. This part attaches to the patient's IV. Again, same thing with the secondary tubing. We have the spike, keeping the cap on to keep it sterile until we're ready. The drip chamber. The roller clamp, keeping off again until we're ready. And the adapter. The only thing different with this adapter from the primary is that this is actually going to go into the Y port of our primary fluid. So now we are going to grab our fluid, remove the cap on the spike, and we are going to spike our bag. Okay, again, making sure our roller clamp is shut so that the fluid doesn't go rushing out. Also want to make sure our tubing is not all tangled up. We want to hang the fluid up and make sure the IV container is at least 30 inches from above our IV site in adults. So we're going to go ahead and hang that up. Okay, we want to fill the drip chamber halfway when we're ready. Again, making sure our roller clamp is off so that the fluid doesn't rush out, but we want to fill our drip chamber halfway. Okay, and next we want to prime the tubing to make sure all the bubbles are removed from the tubing. So we're going to go ahead and do that now. So we're going to open up our roller clamp and get all those bubbles out. Also, I want to remove the adapter end so that the bubbles can come out. Okay, the bubbles are all out, so we're going to go ahead and we would attach the adapter to our IV at that point. Now we are going to count our drip chamber here for 1 minute to make sure we have 38 drops. And we are good to go. Okay, perfect. We got 38. Okay, we're going to close that. We want to make sure, again, our patient is not allergic to any medication. So before we did our medication, we want to just, again, verify that the patient doesn't have any allergies. So like with the first bag, we want to spike the bag, making sure our roller clamp is closed again. Okay. So for the piggyback, we want to make sure we hang it above our primary bag. So we're going to go ahead and do that. Okay. Again, squeeze the drip chamber until it's half full, and then we want to slowly open our line. Okay. Slowly open up our line. Take out that adapter cap and just make sure that the air bubbles escape first. So we're going to go ahead and do that. Okay, perfect. So next we are going to grab an alcohol swab and swab the Y port so that it's clean. Okay, we want to let that dry before we add on our secondary tubing. Okay, now we want to attach our adapter onto the secondary tubing. All right, all the air bubbles are out. So we want to go ahead and make sure that the flow is good, that we have 100 drops per minute. So we're going to go ahead and do that now. And starting now. Okay. So once the patient's good, we'd want to make sure we assessed the IV site to make sure there's no signs of infiltration, redness, swelling, anything like that. We also want to make sure that our patient is comfortable. Again, ask them any questions. Maybe monitor them for a couple minutes just to make sure that the they don't have any like harsh reactions to the medication. We would then want to make sure our gloves are removed. We would want to document the procedure and take any trash with us that we accumulated.